Good morning. Today we are discussing about the brachial plexus. This why you want to know about the brachial plexus. There is the main nerve supply to the upper limb. They have known main upper limb. We want to do actions of the upper limb. We know about the brachial plexus. This is the main nerve supply from the upper limb actions. The nerve supply to upper limb. They have the brachial plexus. They have the supraclavicular branches of the cervical plexus. The branches of plexus, brachial plexus is the C5, C6, C7, C8 and T1. This is the root value of the brachial plexus. The intercostal branches of second intercostal nerve. This is the partially they help combine to form the brachial plexus. The brachial plexus they have the anterior and posterior. There have the brachial plexus have the five parts. The brachial plexus, the supraclavicular in the neck, the root, trunk, the posterior to the clavicle, the divisions, and inferior clavicle in the axilla. There have the cords and branches. These five parts of the brachial plexus have the root value for this starting from the C5, C6, C7, C8, and T1. This is the simple diagram of the brachial plexus. They say seeing about C5, C6 combined formation, and C7 is separately going, and after that C8 and T1 root is the combined formation. This the anterior rami of C5, C6, C7, C8, and T1. The spinal nerve they have helping the actions of the muscles. The ventral rami only the providing the information. The ventral rami is the only the supplying the actions of the motor function. The action motor neuron and neuromuscular junction combined connecting from the muscle to the actions. The ventral. The also fibers is contributed by the C5 and the action. The profound prefixed plexus. They have the large contribution of the C4, but not from the T1. This is the prefixed flexion. After the post-fixed plexus, they large contributed by the T2, but not for the C4. The brachial plexus, the root value, they have the three roots. The three roots, they have the C4 and C5 and C6 combined to form upper trunk, and C7 separately forming the middle trunk, and C8 and T1 combined to form lower trunk. This is the formation of trunk. First we know about that root value of the brachial plexus. The root value for the C5, C6, C7, C8 and T1. The combined of the roots for formation of the trunk. The combined of the trunk there have three portions. The C5, C6 combined to form the upper trunk, and C7 separately forming the middle trunk. After that C8 and T1 combinedly to form lower. After the brachial plexus, they divided by two divisions, the root and trunk and divisions. They come into the division. There every trunk have have separately divided by the ventral division and dorsal divisions. What is the purpose of ventral division? Is supplying the flexor aspect of the arm or forearm to the upper limb. The dorsal division is supplying for the posterior surface or the extensor aspect of the upper limb. The branches of plexus of the three cords divided in the forming the division of the jointing to form the cords. The ventral cord of the upper and middle trunk to combine to form the lateral cord. The ventral cord of the lower trunk is separately forming the middle cord. After the dorsal division of all trunk, anterior, upper trunk, middle trunk, lower trunk of the dorsal division to forming the posterior cord. The branches of plexus, the branches of roots, the nerves of the serratus anterior are long thoracic nerve. Nerves to the rhomboids are dorsal scapular nerve. Branches of plexus, the branches of the trunk, the only from the upper trunk, the suprascapular nerve and nerve of the subclavian nerve. The branches, brachial plexus branches of the lateral cord. The lateral cord, they have branches of three nerves branches. Lateral pectoral nerve, musculocutaneous nerve, and lateral root of medial. The branches of plexus, the branches from the medial cord, the medial pectoral and medial cutaneous nerve, medial cutaneous nerve of forearm, and medial root of median nerve and ulnar nerve. These all the nerve branches from the brachial plexus medial cord. Brachial plexus posterior cord. The posterior cord have the upper subscapular nerve, nerve of latissimus dorsi or thoracic nerve, and lower subscapular nerve, axillary nerve, and radial nerve. This is the brachial plexus forming from the root of neck to the axilla. They combine to form the same branches, have the axillary artery also continuously forming. This is the brachial plexus injury. They have a brachial plexus have three types of injury: avascular injury, stretching injury, or ruptures injury. The site of injury we discuss about Eps palsy. The Eps point site of injury of upper trunk is known as Eps point. There have the three nerve meeting point for the root of C5, C6, and subscleral suprascapular nerve, now to the subclavian, dorsal division, and ventral division. This all the six nerves combination formation of the Eps point. This they have the injury from the Eps point. They have the Eps palsy. Eps palsy is causing the undue separation of the head of the shoulder, the birth injury, fall of the shoulder during the anesthesia. The root involving the C5 and C6. The muscle of paralyzed by the biceps, deltoid, brachialis, and brachioradialis, supraspinatus, and infraspinatus, and supinatus. S point is arm. The position of deformity is position of the limb is policeman tip hand or porter's tip hand. This is the arm, the hang by the side adductors and medial rotation. Come to the forearm, the extended and the pronation. The disability is adductions and the lateral rotation of the arm of the shoulder. The flexion and supination of the forearm. The loss of biceps and supinator jerk. The loss of sensation of over the lower part of the deltoid. This all of the Eps palsy. Second one is clump paralysis. The site of injury is lower trunk of the brachial plexus. There the cause of injury, the undo the adduction of the arm as the inclining position, something after a fall from the height or the birth injury. Nerve root is involving for the T1 and the partially by the C8. The muscle of paralyzed for the intrinsic muscles of the hand, ulnar flexor of the wrist and fingers. This disability of the motor loss, the paralysis of the ulnar flexor of the fingers, loss of sensation, the long ulnar border of the forearm and hand, the Harms syndrome, the ptosis, myos, and hydros, loss of syphilitic reflex due to the injury of the sympathetic fibers of the head of the neck in the T1. The deformity is called known as the claw hand. The hyperextension at the metacarpophalangeal joint and flexion at the interphalangeal joint. This is the injury of the Eps palsy. Injury to the nerve to the serratus anterior nerve of the bell. The cause sudden pressure on the shoulder from the above carrying heavy load on the shoulder. The deformity is winging of the scapula. Disability, loss of pushing and punching, loss of overhead actions. Thank you.